know our veterans a lot better than what we're giving our veterans today, my friends, and I'm embarrassed about it, and I'm committed to it. George Washington in 1789 said, "The ability to attract young people to serve their country is directly related to how we treat those who have served before them." We need to force the system to compete on cost and quality outcomes that will make the entire system responsive to American families. One of the fundamentals of what I'm proposing is we reform payment systems to moving away from paying for fragments of care. Pay providers an annual fee for care that meets quality standards when treating patients with chronic diseases or multiple chronic diseases rather than on a per-service basis. Now, my friends, I understand that's revolutionary. I understand it's counter to the system today. But why don't we give complete quality care to our patients rather than every time they get an MRI or any other procedure that we charge them for those services individually? Require transparency from providers regarding their record on medical outcomes, quality of care, costs, and prices. Across the board. I read the Des Moines Register. I saw on the front page in the headlines yesterday that the Attorney General is suing the pharmaceutical companies for vastly overcharging for pharmaceuticals. Then you should ask yourself the question, how were they able to get away with it? Because there was no transparency. If we'd have known what the cost of those pharmaceuticals were to the pharmaceutical companies, could they have gotten away with the overcharging that they were able to do so? I don't think so. Maybe I'm wrong, but I don't think so. Medicare needs to become more accountable healthcare system regarding efficiency and good critical outcomes. Medicare should not pay for preventable medical errors or mismanagement. Medicare should move to a single payment for all the care of the most complex types of cases. Build a genuine markets by permitting providers to practice nationwide. You may have seen in Katrina, there were some doctors that they wouldn't let practice in Louisiana because they were not registered in the state of Louisiana. What's that all about? We ought to be able to have insurance companies available to you, insurance policies available to you, not just here in Iowa, but across this nation. If you can find a better policy in Arizona, where you will come to visit it this winter, I hope, that then you should be able to do that. You should be able to find the best health care policy in America available to you crossing state lines. And I also want to tell you, if here we want to set up a health insurance program, policy program, do it. Do it. Why not? That's what competition should be all about. Foster the development of routes for safe, cheaper, generic versions of drugs and biological pharmaceuticals. Develop safety protocols that permit re-importation to keep competition vigorous. I think we should be able to re-import drugs, pharmaceuticals from Canada. I think that in the Medicare Part D, we should have pharmaceutical companies compete for contracts to treat senior citizens. That bill, my friends, was written by the pharmaceutical companies. And it prevented re-importation, and it prevented pharmaceutical companies from being able to compete for contracts to provide pharmaceuticals to senior citizens. Maintain market competition through vigorous enforcement of federal protections against collusion, unfair business actions, and deceptive consumer practices. Reform the tax code to eliminate the bias toward employer-sponsored health insurance. Eliminate that bias towards the employer-provided health insurance and give every American $2,500 tax credit, refundable tax credit, and $5,000 for every family so that they can go out and purchase the health insurance policy of their choice. If individuals owning innovative multi-year policies cost less than the full credit, in other words, they find a policy that they already have one and they don't need an additional policy, then give it and let them put it into a health savings account. Create national markets for health insurance, as I mentioned. Reform Medicaid to permit beneficiaries to use the cash value of Medicaid and S-CHIP toward the purchase of private insurance. Require any state receiving Medicare, this is important, you all know, that there are 5 major diseases that take 75% of healthcare costs in America. And you know those people with those diseases have great difficulty, if not impossible, to acquire health insurance. You all know that. Big, huge problem, and it's getting worse because as obesity and diabetes and other problems grow in the United States of America, then we should have states that receive Medicaid to develop a risk adjustment bonus so that we can treat people who have high cost, who are of low income, to supplement tax credits and Medicaid funds to treat these chronic diseases, which are such a drain on our healthcare costs in America. Competition, obviously, we need. And finally, I'd just like to mention, again, childhood obesity, diabetes, and high blood pressure are all on the rise in America. That's a shame. It's a shame that diabetes, high blood pressure, and obesity should be on the rise in America. I think we've got to start by a vigorous education program in America. And I'd aim at parents and as well as children. And I'd find out, if I remember the school board, what the diet is. It's the school lunch program. What are we feeding those children? What are we encouraging in America? In school, do we have enough physical education programs that maybe, and again, this is up to the schools. Maybe the schools should mandate that every child in school be involved in some kind of physical education programs. We ought to do a better job of educating kids on the evils of tobacco. Why in the world is it that every movie I see, Leonardo DiCaprio keeps on smoking? What's that all about? Shouldn't we talk to Hollywood and say maybe it's not a good idea for these young people's role models to be smoking all the time? And I haven't had a cigarette in 28 years, and I'm telling you, I still want one. And so I hope that, I hope that we can go to work on that. My friends, I would like to summarize, and I apologize if I took too long, because I want to hear from you, because you're the people that have to deal with the issue every single day. My friends, we've got to do bold things. We've got to give straight talk to the American people. We have to change this system before it goes bankrupt. Now, present-day retirees, generally speaking, are okay. But my dear friends, don't we owe an obligation to our children and our grandchildren to give them a system that will take care of them? I am a proud conservative. I am a proud, smaller government, less regulation, lower taxes, conservative. But we are a Judeo-Christian principled nation. We have an obligation to care for all of our citizens and those that can't take care of themselves. And one of them is to give them dignity in their retirement years. And that's really and we have that obligation, but we also have the obligation to make sure that that's there for the next generation of Americans. So that's what this national debate is about and should be about. And I appreciate your knowledge, your information, your input, and your dedication to caring for those in our society, here in Iowa and in our country, to care for those who need the care that obviously all of our citizens deserve. It's our job to keep it. Thank you for listening to me, and now I'm ready to respond to any questions or comments that you might have. Thank you very much.
And Senator, we do have some microphones that can be passed so that everybody can hear the question.
Questions? Yes, ma'am. Yourself.
I have a comment, not a question. I would like to thank you for all the great sacrifices you've made for our nation and all that you've done for our country. Thank you.
Thank you for those kind words, and if you're not busy, I'd like